Afternoon, everyone. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health. As always, thank you for joining us. Leading our press conference today, already stressed out hospitals, who needs monoclonal antibodies, and who's getting sick now. Joining us is our State Health Officer, Dr. Thomas Dobbs, State Epidemiologist, Dr. Paul Byers, and Senior Deputy and Deputy of Health Protection, Mr. Jim Craig. I made you a deputy of both, Jim. Actually, he's a Director of Health Protection. Dr. Dobbs, let's start with you and talk about, we have seen increased vaccination rates, and that's a good thing.
So, we've had a rough couple of weeks with pretty remarkable case numbers and really a healthcare system that's been stretched beyond its limits. There's no doubt about it. And just want to go ahead and give a shout out to the great work that they're doing across the state, and hope that if you see someone working in the hospital, you give them a hearty thank you, because they're really going above and beyond. Now, but we are seeing some advances in other fronts. We're seeing an increase in the number of people who are getting vaccinated, and that's super helpful. We've got about 1.4 million Mississippians who've had at least one dose, and about 1.2 Mississippians that are fully vaccinated. And that's going to pay huge dividends going forward as far as people who are going to get infected or get severely ill or, sadly will pass away. If we look at the entire context, what we're looking at, there is some very exciting news from around the world, and especially from Israel, where it looks like that natural infection does seem to be really helpful in preventing future infection. If we combine that with folks who are immunized, that will probably have real benefits at reaching more of a population threshold for getting back to steady state transmission. And I'll talk about what I mean by that in a second. I do want to reiterate, we still strongly recommend that people, even if you've had COVID, go ahead and get vaccinated, because we know that it will greatly augment your immunity, and it decreases the risk of reinfection by half. So there are great benefits to getting vaccinated, even if you've had COVID before. We know that the Delta variant is highly infectious. We need to have probably about 85% of our population immune based on that level of infectiousness to reach a level of transmission where we'll have low, steady transmission. I hate to use the term herd immunity because it's not really applicable to this type of virus, but it would be phenomenally beneficial to have that level of immunity within our population. We can't let our guard down. We've got a lot more coronavirus to go through before we can get back to where we were previously. I do want to, say that hopefully we're not going to see the same sort of peak we've seen in the coming weeks. We're starting to see some stabilization in numbers and hospitalizations, but again, time will tell. And the better that we do at both preventing transmission and getting vaccinated is going to help us out of that. A couple of things that are worth discussing also: monoclonal antibodies, hugely helpful at preventing severe illness or death if you've been infected. So if you were diagnosed with COVID, please check out monoclonal antibodies. Pretty much everybody in the state of Mississippi qualifies based on the criteria. If you want to figure out where to get monoclonals, there are a lot of easy ways to do it. You can call your physician or your clinic, but also we have our COVID hotline where you can get information about getting connected with monoclonals, and that's 1-877-978-6453. We also have extensive information at at msdh.ms.gov/MAB if you want to learn more about how to get monoclonal antibodies online. Someone had chastised me for not mentioning the sub-Q option. We consider that as a very valid way of using it and encourage it because it's more efficient for folks to get more monoclonals. So there are options that include an infusion, but also a subcutaneous injection that is approved for treating COVID. The monoclonal antibodies are also useful for prophylaxis for people who are high risk who've been exposed to COVID, and that's another option that's worth discussing with your provider. Third doses or booster doses. Right now, we are promoting the use of the third doses for people who are immunocompromised. If you have a weakened immune system from cancer, transplant, or other reasons, or if you have a weakened immune system for any reason that your doctor thinks appropriate, I encourage you to seek out that third dose to augment your immunity. It's available at pharmacies and clinics, but also at the county health departments. You can schedule yourself for a third dose, and you go to covidvaccine.umc.edu and you can sign up for appointment for that additional dose if you have a weakened immune system. Liz, that's all I have, and I will kick it back to you.
Okay, thank you, Dr. Dobbs. Dr. Byers, why don't we start with you with an update of cases?
Yeah, thank you, Liz, and thank you, Dr. Dobbs and Mr. Craig. I just want to give us a brief overview of what we're seeing now. You know, MSDH is reporting out over 2,900 additional cases today and 81 deaths. And I'd like to give you all some perspective of what we have been seeing over the last month. And so I do want to share a couple of slides with you just to give you an idea. And these are case numbers by comparison as they occur over the month. And you can see previously back in December and January were our previous peak months. You can see the number of cases that we've had to date in August alone is over 85,000 cases. And we're not done with August yet. Certainly we're into September now, but cases that have had onsets in August will still be reported. So we anticipate that that number is going to increase. And so far and away, August has been our most significant month in number of cases. When we look at the deaths, you can see that back during our winter surge, we had over 1,200 deaths that occurred at any one time in 1 month, and that was in January 2021. We're not at that same point yet, but we've still had a staggering number of deaths that have occurred in August so far. And again, that number is likely to grow as additional reports come in. And so we are still seeing high numbers of cases and high numbers of deaths as we move into August. When we look overall at that epi curve that we've looked at many times before, you can see the perspective of where we are now with the numbers of cases that are reported as they occur on a daily basis compared to where we were in the previous winter surge back in December and January. And you can see the number of deaths, and we are continuing to see elevated numbers of deaths now. One of the things that has been very promising for us is the reduction in the impact in our long-term care settings, primarily because of the high vaccination rates that we've had among the residents there. When we look at our hospitalizations, we have seen some stabilization. As Dr. Dobbs mentioned, we reported out 1,543 individuals currently hospitalized with confirmed COVID. That compares to our previous high back in mid-August of 1,667 cases that were hospitalized with confirmed COVID. But you can see that we have had some stabilization overall in our hospitalization numbers with individuals who are requiring ICU care and individuals who have been who've had to be on the ventilator as a result of COVID infection. And although our numbers are still very high with case numbers, very high with hospitalizations, ICU and ventilator use, again, we have seen some stabilization of these numbers, which are encouraging, and hopefully we will begin to see some decreases in this as we move forward into September. When we look at who the hospitalizations are impacting now, we still see high numbers of hospitalizations in those individuals who are 50 to 59 and 60 and older. But as you can see, we have had a growing percentage of cases among younger individuals, especially in the 30 to 39-year-old age group. And when we look at the impact of cases that are occurring in the state, we've certainly, especially since we started back school, we've seen a high proportion of cases that are occurring in our kids 5 to 17 years of age. And that's been a growing percentage that we've seen rapidly increase over time. You know, we did have a reduced number of schools that reported out to us this last week for the number of cases in students and teachers and the number of folks that they have on quarantine. But we still had over 23,000 children out in the previous week on quarantine as a result of exposures to COVID-19. We did have over 500 teachers and almost 4,000 students that were reported as new cases in that previous week. And that's with only 669 schools reporting. So we are still seeing a significant impact in our school settings and on our children. And at last report, we had 27 children who were currently hospitalized with COVID-related illness. 7 of those in the ICU and 1 of them on the ventilator. And just as a reminder, we have had 6 deaths in children under the age of 18 so far during this pandemic. We continue our efforts with schools and continue to provide options for screening testing to be done in on-site in the school, either through provision of tests directly to those schools or through our vendor, which will go on site and do the testing for them. And we have over 40 schools or school districts that are participating in one of those options now for testing on site at the school. Excuse me. Additionally, we are promoting vaccination efforts on the schools through providers in the state. And we have 74 schools, individual schools that have signed up to have vaccinations on site, and an additional 17 school districts. And just as one last reminder of where we are seeing the impact with the number of cases, hospitalizations, and deaths in Mississippi, the overwhelming majority continues to be among unvaccinated individuals. 99% of our cases, 87% of our hospitalizations, 87% of our deaths continue to be in individuals who are unvaccinated or partially vaccinated. And so, Liz, that's my report for this afternoon, and I'll turn it back over to y'all.
All right, thank you so much, Dr. Byers. I can't imagine anyone looking at that chart and not seeing the true picture there, the importance of the vaccine. Mr. Jim Craig, Senior Deputy and Director of Health Protection. Our hospitals, you've worked IDA all weekend long, as many of us did, and we already have stressed out hospitals. Can you kind of talk to us a little bit about where we are right now with our hospitals?
You bet, Liz. Thank you. We are seeing some improvement in the hospital bed availability across the state, but ICU space continues to be scarce. As you know, the COVID-19 system of care remains active and mandatory for all our hospitals in the state for transferring those critical care patients that just can't be accommodated by the normal referral processes. The health officer order that we have related to that system has been renewed and includes the continued delay of Tier 1 and Tier 2 elective surgeries in the state that may lead to a overnight hospital stay. Since the system was activated, Mississippi MedCom reports that more than 1,735 patients have been transferred in our COVID-19 system of care. And as of 8 o'clock this morning, critical care hospitals reported 13 ICU beds available with 213 emergency room holds. Those are folks being held in the emergency room waiting for a bed. Of those, 93 of those patients are waiting on an ICU bed. Of those 93, 26 are COVID patients waiting on an ICU bed. So with patients still waiting on ICU beds, our ICU bed capacity is still effectively 0 in the state. We do have additional beds and ICU capacity in some of the hospitals in the state, but we continue to have the problem of just insufficient staffing to operate all the beds. Efforts continue to help increase those and increase the staffing for the care of the COVID patients. If we look at the federal front, we still have our partners at the VA, both in Biloxi and Jackson, providing 5 ICU beds at each facility for COVID-19 rotation. We do have the Department of Defense medical team still at the UMC. It's a 23-person DoD team that continues to assist with the COVID patient care at UMC. Yesterday, I requested that this team be extended for an additional tour. Additionally, there are 7 U.S. Public Health Service team members at UMC assisting with the monoclonal antibody administration. And of course, Samaritan's Purse continues operation over at UMC in Garage C to help with some of the statewide transfers in the COVID system of care, as well as helping decompress overly congested hospitals. The facility is still operating 32 beds, of which 7 beds are ICU. And I can't tell you how much we appreciate them being here in Hurricane Ida. They were instrumental in assisting with the decompression of some of our hospitals during our Hurricane Ida response. Our 23-person Department of Defense team continues assisting with COVID patients in North Mississippi Medical Center. And today I requested that components of this team also be extended. We continue our 10 two-person federal teams that are assisting with the administration of monoclonal antibodies around the state. Remember that these teams are in addition to the current resources we have out there, including our COVID centers of excellence that provide monoclonal antibody treatments. We have requested an extension of these teams and 8 additional teams to assist in the administration of monoclonal antibodies. Just as a reminder, the EMS services in Mississippi still remain very stretched thin. Their priority remains responding to 911 calls as well as emergent transfers. But the pressures on the healthcare system continue to result in them having longer transfers, as well as, in some cases, longer wait times in delivering patients. Those services have now reported sufficient ambulances, but lack necessary staffing. We have requested additional EMS resources from FEMA and the Federal Health and Human Services and hope to receive that support soon. Staffing for hospitals remains a critical need around the state. Working with the governor and MEMA, physicians, critical care nurses, nurse practitioners, and respiratory technicians continue to be deployed to hospitals to open much needed beds and those ICU spaces we need. Of the currently requested 1,138 staff, just over 74% have been deployed to hospitals and more being placed daily. Looking to COVID testing, we continue to address COVID testing demands around the state, especially those areas with little to no free COVID testing available. So we're increasing access in the following areas this week. In Calhoun County, at our health department there, 2 half-days per week starting yesterday. Chickasaw and Choctaw County health departments, 3 half-days per week starting today. Hancock and Harrison counties will be at their health departments for 5 full days per week starting tomorrow. And we hope to have 5 full days in Jackson County starting the next day. In Lee County, at the health department there in North Mississippi, we'll also be moving to 5 days per week starting today. Once again, we've increased our appointments at Rankin County at Trustmark Park. We now provide 500 appointments per day at this location. Hurricane Ida did impact some of our COVID vaccination events as well as some of our locations, but most are now reporting that operations have resumed. There are no pop-up vaccination sites this week, but our health equity team remains busy working with partners to help increase vaccination opportunities in Mississippi, especially in those areas of health disparities. Let's share with you a couple of the things that they have going on in my brief today on these slides, and know that these slides will also be available on the website, at the health department's website under the news area, just immediately following this briefing. So if we look at the community health centers and the community vaccination partners and some of the activities that they're doing with the health equity unit, you can see for Pfizer first dose appointments, we have in Jackson, Louisville, Holly Springs, D'Iberville, Itabena, Hattiesburg, Columbia, Clinton, and Rosedale. We're also in Hattiesburg, Petal, and Vicksburg. At Delta Technical College, we'll have Pfizer as well as J&J in Jackson. Other Pfizer appointments in Pearl, Morton, Hattiesburg, Horn Lake, Vicksburg, Bolton, and in Houston. Additional, we'll have in Clinton, Jackson, Pearl, Greenville, Van Cleve, Starkville, Hattiesburg, Brandon, and of course the ongoing vaccination location we have for the International Seafarer Center in Pascagoula, which is a J&J site. You notice that the Pine Lake Church in Brandon will also be Pfizer, Moderna, and J&J at that location. We look at second dose opportunities. As you can see, we're in a number of places in the state providing those second dose appointments. And remember that free COVID vaccination is available at all our county health departments during our normal operation hours. As Dr. Dobbs said, you can make an appointment at covidvaccine.umc.edu. Also, if you're homebound, know that we are trying to provide homebound vaccinations in those areas that we're serving with pop-ups, and/or if you just know someone that's homebound and ready to be vaccinated, let us know. We're happy to try to work to ensure they get their vaccination opportunity. A little update on IDA. The health department continues to provide personal protective equipment to healthcare facilities and others around the state. And our stockpile right now still looks to be very, very good. But all the hospitals and long-term care facilities are now reporting they're back on commercial power. We do have 4 hospitals and 3 nursing homes that report minor structural damage. Our Pike County Health Department has power restored and opened up this morning. Lincoln County Health Department in Brookhaven still remains closed. We look to our public water systems. 93% of all systems are operational. We have 7 of those systems currently on boil water notices affecting approximately 8,555 Mississippians. On boil water is the village of Glendora in Tallahatchie County, Hideaway Hills Water Company in Panola County, Sunny Hill Water Association in Pike County, the Wilk Amit Water Association number 1 South in Amit County, Oak Harbor in Hancock County, and Sunrise Mobile Home Park in Hancock County. Lastly, Willow Grove Water Association in Covington County. All of those systems are currently under boil water. And remember, if you receive water from one of these systems under a boil water notice, that you should not drink the tap water. Bring the water to a rolling boil for 1 minute to kill most organisms. Do not use ice made from recent tap water. And once the boil water notice has been lifted in your area, remember to discard the ice that was made during the time the boil water notice was in place. Don't use tap water to make juices or drinks. Cook with tap water only if food is boiled for at least 1 minute. Washing dishes, fruits and vegetables in boiled water or water that's been disinfected with bleach. And there's some information on our website about how you can use a little bit of bleach to also disinfect water. Using your home dishwasher is not recommended. Brush your teeth with boiled or bottled water. And wash your hands and bathe as usual. Bathing is safe as long as no water is swallowed. Washing laundry as usual. Laundry washed in hot or cold water is safe. So Liz, I'll throw it back to you for any questions.
Okay, and Mr. Craig, one thing I did want to ask you about is restaurants. And during Katrina, we had a lot of issues with restaurants. Are we seeing that in the lower 6 counties with IDA?
We do have, we had an entire emergency permitting process that we had to put in place for many of the storms, including Hurricane Katrina. But our inspectors are out and available to assist restaurants at putting their services back in place following either boil water notice and or following restoration of power. So we have not heard of any reports of problems getting restaurants back open.
Okay, thank you so much. Let's start with Ross Adams from WAPT. Are there any concerns Mississippi COVID numbers could rise because so many people fleeing the storm in Louisiana are temporarily staying here? Dr. Byers, you want to take that?
You bet. Thank you. Certainly when we have people moving around and more people interacting with each other, there is always a potential that we'll see increased cases. But I think, one of the things that the storm did too was disrupt a lot of the activities, especially social activities that people would have normally been engaged in. And so it's going to be hard to gauge what level of transmission there may be as a result of the storm. Certainly, we remind everybody, if you were displaced, make sure that you continue to put in place those isolation and quarantine procedures as they apply. Make sure that if you're in a public setting, if you're interacting with folks that you don't normally interact with in an indoor setting, certainly mask or physical distancing are in order. So continue to have in place those measures that you would normally do to prevent transmission of COVID. We know that there's going to be displaced folks. We want them to be safe. We need for them to have a place to stay. And, we're going to watch and see what the transmission does.
Okay, thank you, Dr. Byers. Brad with Local 24 News in Memphis. Is there a breakdown, Jim Craig, this will come to you. Is there a breakdown of specific outside staffing brought to assist DeSoto County hospitals? And will that assistance be in place of a possible field hospital in DeSoto County? Can you address that?
Yeah, Liz, I'll have to look at the information to get the exact breakdown for DeSoto County, but I will say that, there are 61 hospitals in the state that have requested resources. DeSoto County is one of them. And I know that we had conversations with the county as we looked at whether or not a field hospital was appropriate at this point. In the real feeling of the two hospitals up there, DeSoto, as well as the other hospital in DeSoto County at Methodist, was that they wanted to make sure that they had fully utilized the brick and mortar spaces that they have for beds and ICU spaces with this additional staffing first. So I think that's really the focus right now in DeSoto County.
Okay, thank you. Will Stribling with Mississippi Today. There were 300 fewer schools reporting COVID numbers this week compared to last week. MSDH's data has a note that, quote, Hurricane Ida may have affected schools' ability to report numbers, but I don't really understand why. No schools were closed Friday that I know of. Anyway, my questions are, one, why would the hurricane have affected last week's reported numbers? And two, what kind of effect does it have when we don't have a complete picture of what is actually happening in schools COVID wise? Dr. Byers, can I get you to take that again?
Yes, ma'am, I'd be pleased to, and thank you for the question. It's a good question. Yeah, the hurricane will impact the school's ability to report. The reports are for the previous week, and the vast majority of schools report to us on Monday. We had many disruptions, many schools that were dealing with potential impacts due to the hurricane over the weekend and certainly into Monday and even into Tuesday. And so we know that many schools are still looking at their operations, and certainly that could have impacted their ability to report. We do know that we had a few hundred schools less this time around reporting than the previous week. That does impact what our overall view is for the absolute numbers, but we do know that a number of the schools are still being impacted by COVID and the numbers of cases, as well as the number of individuals that are out on quarantine. That's not the only way that we communicate with schools through those reports. We also work very closely with the schools one-on-one. Schools know how to reach out to us and ask us questions and tell us about the situations that are ongoing at those schools. And that's another way that we are able to determine what's actually happening in the school settings, is through our one-on-one conversations with them. So this reporting tool that we make public is just one of the tools that we have for determining what's really happening in the schools.
Okay, thank you, Dr. Byers. Dr. Dobbs, the next couple questions are coming your way. Tushar from ABC News is asking, do you have any concerns about people asking for monoclonal antibodies instead of vaccination for immunity? Dr. Dobbs?
Not really. I mean, we just want to protect folks. And if people are sick for whatever reason, then monoclonal antibodies is the way to go. So that's absolutely just the right thing to do. And if people are exposed and they're at risk, then they need to get monoclonal antibodies. It's a therapeutic option that's very effective, but it's not a vaccine. It has a short, limited duration of efficacy. And the vaccines do a lot of things. They keep you from getting sick, and they keep you from spreading it to your family. So they have different roles, and we want to use them all as aggressively as we can.
Okay, thank you, Dr. Dobbs. I want to scoot back to Kelly Roberts with Action 5 News. She is asking, are all MSDH vaccination sites now open after Hurricane Ida? Any concerns vaccines could decrease in the week following the storm? Mr. Craig?
So I believe, other than Lincoln County, all the sites are reporting back availability for vaccine in the system. Lincoln County is still one of our counties that is impacted by the power outages in Southwest Mississippi. And I would hope that Mississippians continue to come out and get vaccinated. It's the right thing to do.
Thank you. Dr. Dobbs from Kobe Vance with MPB. In that study from Israel, what strain of natural immunity was being monitored? Is that any COVID infection or infections with the Delta variant?
Based on the time periods that they were looking at, it would have certainly included a lot of non-COVID Delta variants. So I don't know that they distinguished it. I didn't see that when I looked at it more closely, but the implication would be that there would be some cross protection from non-Delta variants from my reading of the study.
Okay, thank you, Dr. Dobbs. CJ Lemaster with WLBT. Our 7-day average has dropped to its lowest in nearly 3 weeks, though our test positivity rate remains above 20%. I know Dr. Byers was cautious to say last week that we may have peaked. Dr. Dobbs, what are these various indicators telling you with regard to what we'll see in the coming days and weeks? One health expert even said we could see a 5th wave. Dr. Dobbs?
Yeah, we're always hesitant to predict too soon, but we certainly are seeing a stabilization in cases, and we've started to see a modest decline in daily hospitalizations, which is certainly, welcome. But I do want everyone to keep in mind that it's at an extremely high level. And so it's not at a point where anyone should be feeling complacent about where we are, because these cases are continuing to drive hospitalizations. We're going to have pressure on the healthcare system. So, it's better than the option, but it's far too high. We need to continue to prevent transmission in every way we can so that we can prevent as many deaths. We're approaching 1,000 deaths in the month of August. I just want to reiterate that almost all of those deaths were preventable. Most of the deaths that are going to happen over the next month are and would be preventable. So everything we can do to prevent severe illness and death, we need to do right now.
Thank you, Dr. Dobbs. Lauren with the Sun Herald. Can you talk about COVID concerns on the coast after Hurricane Ida, with many from Louisiana coming over for food, gas, and shelter? What advice do you have for the coast and Louisiana residents? Jim, why don't I start with you?
Yeah, and I think we're already seeing part of this. We're seeing folks come over from Louisiana. We've had some individuals that require some additional health care that have come over that maybe needed dialysis services. And we're, just like everyone helped us during Hurricane Katrina, we're trying to help as much as we can. But I do think right now on the coast, we're seeing some increased stress on traffic, hotels, spaces, restaurants, a lot with Louisiana evacuees and folks trying to get back into Louisiana, visiting our state right now.
Thank you. Dr. Dobbs or Dr. Byers, would you like to give any advice?
I mean, the transmission's the same. It's going to be concerning if folks are going to be coming into indoor areas where, you have limited, spacing, airflow, that sort of thing. So, and you're also bringing together new people, right? So the same prevention messages are very important.
Dr. Byers?
No, I agree with Dr. Dobbs. I mean, we're in a lot of stress right now, and folks are having to move about and take care of their essential needs. And sometimes that does mean they have to interact with people they don't normally see. So again, especially if you're not vaccinated, please, wear a mask in those public indoor settings, especially when you're interacting with people that you're not usually interacting with.
Okay, thank you, Dr. Byers. Steve, I don't know if we have this, but if we don't, I'll get it for you. Have any barber shops or salons signed up for the Shots at the Shop program? Tammy Yates in my office, if you know, can you write me? And do you have to know, Jim?
I'll say, Liz, I have that. If you
Okay,
like.
thank you.
Yeah, no, right now it looks like we have about 12 signed up thus far for the Shots at the Shop program. So just a reminder, we're inviting all the barbershops and salons throughout Mississippi to participate in this program. The program allows barbers, stylists to provide vaccine, education materials and resources, as well as host some vaccination events for us. Usually the shop owner designee can be awarded up to $1,000 to become a trained community health advocate. And all they really have to do is attend a short training to learn more about COVID, vaccinations, the role that barbershops and beauty salons can play in their communities to increase health and well-being. So disseminating information is also a key part in working to schedule a vaccination event. So we do have a location that if you're interested, you can email the program at vaccineevent, all one word, at msdh.ms.gov.
Thank you, Jim. Blake, with the Daily Journal, with 13 ICU beds available at 8 a.m. this morning and 93 people waiting on ICU beds in the state, my question is, how do you prioritize who gets an ICU bed? That's an excellent question. With so many people waiting and so few beds available, how do you determine the order in which patients are placed in an ICU? I'm going to start with you, Mr. Craig.
Yeah, no, good. It's a great question, Blake. Effectively zero means that there are always patients in motion for the most part in the system of care rotation. And the strategy is to try to keep patients locally within their region of the state. So north, central, and south are the three regions that MedCom tries to rotate critical care patients within that region. In most cases, it works. We had a lot of complications with that with Ida as we were trying to decompress out of the southern region to get away from the storm, as well as out of Southwest Mississippi to get away from the storm. So that rotation process normally stays regional, but from time to time, individuals have to be rotated into another part of the state. And that's, it puts a strain on families, puts a strain on everyone when their loved one has to go that far away and all the things it takes to try to support that patient. So that's why we try to keep it as regional as possible.
Okay, thank you. Dr. Dobbs, you want to add anything to that?
No, but I just want to reiterate that, if someone's getting care in the emergency room, they're getting intensive care. I mean, there's a devoted team. The critical care docs will be there also to help, and the nurses are doing a fantastic job. It's just a phenomenal stress. And, the ERs are having to do ICU work and ER work. So, just really be thankful for the folks who are working day and night to save lives in Mississippi.
Thank you, Dr. Dobbs. I missed a question from Dan Goldberg and I missed one from Kobe. I'll catch you two in a second and I'll go to CJ. Week to week, MSDH data shows a decline in vaccinations for the first time in 7 weeks. But anecdotally, people have told us they've seen a lot of parents with kids getting the shot. What does the data show with regard to children getting vaccinated over the last several weeks? And can you speak to those efforts? And that would be 12 and over. Why don't I start with you, Dr. Byers?
Yeah, absolutely. If you look at the data that we're reporting, you can see that we are having increasing percentages of children 12 to 15 and 16 and 17 years of age that are receiving vaccination, and the percentage of overall children in those age groups that are fully vaccinated is also increasing. It's going to take some time, but we have seen that the uptake is increasing in kids, and this is going to be one of the things that's going to help us in the long run, keep a lot of the pressure off of schools and really help to keep the schools in-person learning. So, we do continue to recommend that folks who are in those age groups, 12 and older, everybody get vaccinated. Now, we talked a little bit about the fact that we are trying to help facilitate to have on-site vaccination clinics at schools that are interested. And, as I mentioned, we have over 70 schools that we've helped facilitate and have worked with private providers in their community to go directly on site and provide vaccine for the eligible children, but also the teachers and staff. And we have an additional 17 school districts that are also working to sign up through that process. And this is our Adopt a School program that we have, where we help connect schools with providers in their area. This is going to be one of the things that we're going to want to continue as we head through the school year, to make sure that we have the availability for all children to get vaccinated regardless.
Have we heard anything, Dr. Byers, and you and I haven't talked about this, but I'm just curious, for kids under 12, any scuttlebutt on what they're looking at for that?
Yeah, they're working on that, and CDC and FDA are looking at a number of data sets from several different fronts, and certainly looking at a lower age range for the vaccination is one of the priorities that ACIP and FDA are looking at right now, among a number of other things, including what will a booster dose look like potentially in September for the general population, so for everybody. So, there's a lot of work to do. They're looking at a lot of different fronts. We hope that we'll have some movement on lower age range for vaccine eligibility later in the fall, sooner rather than later, hopefully.
Thank you, Dr. Byers. Let's see, Dan, excuse me for skipping your question. Can you, Jim Craig, we'll start with you on this. Can you tell us what federal resources are currently on the ground? Are you in conversations with the feds for any additional personnel or equipment? We did talk a little bit about that. Dan might have missed it. Do you mind to go over that again, Jim?
No, happy to. And I take it that we're talking about on the COVID front, because, we do have some resources also here on the IDA front, but just to kind of go, just to kind of go over the ones on the COVID front. But we do have 2 Department of Defense teams. They're both 23-member teams. One is at the University of Mississippi Medical Center here in Jackson. The other one is at the North Mississippi Medical Center in Tupelo. We have requested extensions on both of those teams in Mississippi. We have a 7-person U.S. Public Health Service team also at the University of Mississippi Medical Center that's assisting with monoclonal antibodies administration. And we've also requested that team be extended. We have 10 2-person teams, they're paramedic teams that are in the state to assist with the administration of monoclonal antibodies in a number of areas, 10 different locations in the state. And we've also requested that those teams be extended and ask for 8 additional teams to come to our state so we can further spread the opportunities for monoclonal antibody administration. And those are the biggest federal pieces that we have in state. Know that the VA here in Jackson, which is a federal resource, is providing 5 ICU beds in rotation, both at their Jackson VA facility as well as the Biloxi VA. And I think that's most of the federal resources we have in play right now.
Thank you, Jim. Ann Kobe is asking, Dr. Dobbs, can you catch this one? Can you elaborate on the difference between stabilization in cases versus a decline in cases? What does the state need to strive for in terms of daily cases?
Yeah, and that's, you already asked that one, but I'll just kind of say, as far as like, what are we striving for in daily cases? Well, 0 would be ideal. But, I think what we'd like to be able to do realistically is get to a stabilized, steady state where we're having low level transmission. We're going to be seeing cases, for a long, long time. May and June seemed like a vacation now, doesn't it? That we had so few cases, at a low level, still had cases and deaths, but we need to get to a lot lower level to minimize ongoing transmission, hospitalizations, and death.
Okay, thank you, Dr. Dobbs. And Mary Perez with the Sun Herald. Are schools required to report their number of cases when a public records request is filed? So Mary, I'm assuming you mean if you file that with the schools self-report to us. Anyone want to take that? But Dr. Byers.
No, that's going to be between the school and them, and if the school has those on a public record to even be requested. And so our reporting is from the schools directly to us, and we do make those reports of those schools available by school and by school district, and certainly that would have to be a request directly to the school to determine that.
Yeah, thank you, because we're very transparent with all of our information, and the schools do self-report. We encourage them all to report to us. I don't see any questions, so I'll just do around the table. I'll start with you, Dr. Dobbs. One sentence that encourages people to get vaccine.
It saved hundreds of lives, just the Delta surge, and thousands of people in Mississippi already. So please, if you're not vaccinated, get vaccinated. I mean, it's going to save lives and protect your family. So we've been through more tragedy in Mississippi than we had to. Sadly, Mississippi is now number 2 in the country in per capita mortality. This is real stuff that's going on, and we can not only have we had way too many deaths, but we can prevent many more in the future, and that's where we need to go.
Thank you, Dr. Dobbs. Dr. Byers?
You know, just take the opportunity to continue to get vaccinated. If you haven't been vaccinated, take this opportunity now. You know, the FDA has fully authorized Pfizer vaccine for individuals 16 and older. So it's gotten full FDA approval now. We encourage folks not to wait on vaccine for additional research or additional word. Now's the time. We show the protective benefits of vaccination. We look at the impact of hospitalizations, cases, and deaths on those folks who are unvaccinated. And even if you are vaccinated, if you do become infected, please talk to your doctor, look at our website, get information about monoclonal antibodies, access our hotline. They can connect you to resources. Now's the time that we want to save lives. We want to save our hospital capacity, and we want to save lives. And that's what the goal is from here pushing forward. And vaccination and monoclonal antibodies can do that.
Hey, Dr. Byers, can you easily pull up that bar graph chart again?
I can certainly try.
I mean, I just think this says it the best. Okay, and so, oops.
Yeah.
We lost.
Try again.
All right, we'll try again.
And I think that's what we're looking. Well,
Okay, well,
this year.
but what 99% of the cases we are seeing now are unvaccinated people. Jim Craig, you see the hospitals and the shortage in the ambulances and everything that's going on. And I do have more questions, which I'll answer after I get you, Jim. What would you say to people? 99% of the cases are unvaccinated. What would you say as a man who's on the ground and is watching our resources being depleted?
Well, Liz, thanks for that. And in addition to watching resources be depleted and a lot of really dedicated public health, healthcare, EMS, and others working diligently to try to help in this current wave of the pandemic. You know, I get to visit with a lot of families about some of the tragedy that they're going through with COVID. And I think what's probably more common now is there are more and more families to talk to. And there are more and more people that, if they look at their friends or families, they've been impacted by COVID, and many of them in this way. So one thing that I think can really help all of us from the resource perspective, families, and the tragedy that many of the families have gone through, and the fear that many of the families have gone through, would be to get vaccinated. So Mississippians, help us. Get vaccinated, please.
It's a simple solution. I've got a couple questions here that I, of course, will go ahead and ask. Deanna, let's see, she would like to know, is there a way, yes, okay, is there a way for solo practitioners, especially in disadvantaged communities, to have access to the monoclonal antibody treatments? Let's start with you, Dr. Dobbs.
Yes, we have a lot of clinics that are doing it, and we've been recruiting clinics. And so if they can reach out to us, and I don't have the contact information with you right now, but if you have any clinics that want to do it, it's pretty simple to do the subcutaneous. And we have a team of doctors, pharmacists who can help train, sign up, and help people get deliveries of monoclonals. Yes, we want them. And we have over 180 locations in Mississippi where people can get monoclonal antibodies. We have a lot of folks out there, but we want more team members.
Okay, thank you, Dr. Dobbs. Let's see, I don't see any other question. Uh-oh, there's another one. Okay, Rich. Let's see, is there an update on ivermectin use in state or poison control calls? Is it mostly veterinarian formulation or human formulations? And this is Rich Mendez with CNBC. Dr. Dobbs, why don't you start?
Dr. Byers is probably better connected to the poison
Okay.
control data. I don't have any updates since earlier.
So I
Dr.
can tell you
Byers?
that, yeah, thank you. The number of calls have decreased to the Poison Control Center related to potential ivermectin toxicity. This is a good thing and we're currently encouraged by it. Yeah, most of the calls that have been related to potential toxicity have been through potential ingestion of livestock formulations of ivermectin. But again, we're seeing that those numbers have been decreasing. We hope that they'll decrease even further down to zero. And so we're encouraged that the public is hearing the message not to take livestock ivermectin, but in fact, talk to your physician, let your physician prescribe the appropriate medications for you and take them as directed. And certainly if you're infected with COVID, identify those resources and we can help to get monoclonal antibodies.
All right, thank you, Dr. Byers. On behalf of State Health Officer Dr. Thomas Dobbs, State Epidemiologist Dr. Paul Byers, and Senior Deputy and Director of Health Protection, Mr. Jim Craig, I'm Liz Charlotte, wishing you a good afternoon.